Now taking a look at hospitalizations here in LA County, more than 1,000 patients are hospitalized. They haven't been that high since February. Orange County has 277, Riverside County has 190. Well, vaccinations against monkeypox expand in LA County tomorrow. This as CDC scientists are tracking multiple cases in several countries, including here in the U.S. Earlier today, I spoke with Dr. Suman Radhakrishna, a top infectious disease specialist here in the Southland.
The vaccine is in short supply because smallpox has been eradicated, and so there really wasn't a need for vaccination other than people who were veterinarians or students going out to work in Africa. So we had a stockpile, but not enough. That's number one. Number two, not everybody needs the monkeypox vaccine. There is a very specific group of people who have been identified right now who are on top priority for getting the vaccine. These are individuals who've been exposed to somebody who's come down with monkeypox. And if they get the vaccine in less than 4 days, then the disease is preventable. If they get the vaccine within 14 days, then the symptoms are not as severe, but it may not be preventable.
Monkeypox, we want to talk about the symptoms and what people maybe should be looking out for.
The monkeypox in 2022, on the other hand, does not seem to have that much of a prodrome, which is the phase when people are feeling miserable because they're coming down with a viral infection. Instead, they seem to be getting more lesions, which happens to be in the genital area and the rectal area. And that is why, because people are not feeling sick, they can go out and unknowingly infect other people. That is why we are targeting people who are at risk for sexually transmitted diseases in order for them to get the vaccine first.
How important is it, do you believe, for the county to expand their vaccine for monkeypox?
There is need for the vaccine for sure for individuals who've been already exposed or have high risk of getting exposed. But everyone else has to use caution right now while we wait to find out. These vaccines are not without side effects, but if they are going to prevent someone from getting monkeypox, that would be a good thing. Please understand, monkeypox is not fatal, so far, at least based on what we are seeing right now, but it does cause enough amount of anguish and morbidity in the sense of not being well for a long period of time. And if that is preventable, why not? As travel becomes more and more easy, and people can get from one end of the world to the other end of the world in less than a day, infections can spread very rapidly. And this is going to be how things are going to be going forward because of the ease and convenience in which we can get from one place to another. It doesn't mean that we shouldn't be willing to travel and do things. But at the same time, I think we need to exercise some level of caution because you could bring the infection back or take it with you somewhere else and not even know about it and unknowingly, infect other people.